meeting with any announcements. If you use the raise hand feature, we will go around and get the announcements. So Casey?
Good morning. AHRC has monies available in all boroughs for family reimbursement. We also have money available for free evals in Manhattan. I will put the information, contact information, and flyers in the chat. Thank you.
Thanks, Casey. Paola?
Good morning, everyone. Paola Martinez-Boone, New York Lawyers for the Public Interest. We provide free legal services. However, today actually I'm trying to obtain some help from the agencies. I have a client who is 46 years old. He is an immigrant who moved here to the United States when he was 16. It seems to be that he attended a school for a couple of years, but however, he has like an intellectual disability, but it wasn't established before the age 22. So some of the agencies have not been able to help him because he doesn't have a qualifying diagnosis before age 22. So what I'm looking for is an agency who can work with him to establish diagnosis, and so therefore he could apply for OPWDD. So I'm gonna put my contact information in the chat. Any lead, and I will prefer, because I know there are agencies here that are really, really big. If you have a warm referral will be the best, meaning a name, a person, a telephone number, someone that I could connect him directly that could work with the family. That's what I'm been looking for, because I have someone already calling different agencies and, the general number and all that. And sometimes I understand you're all busy and sometimes goes nowhere. So I'm looking for a warm, direct, the direct referral that could tell me, oh no, we have experience doing that, we know what to do, and hopefully we can help this client. Thank you.
Thanks, Paola. Wendy?
Good morning, everyone. My name is Wendy DeLeon, and I am with ADAPT Community Network. We're having a few holiday parties here, so just getting ready for that. I wanted to let everyone know we offer a variety of services here at ADAPT. In case you are interested in housing advocacy, home modification, family reimbursement, rehabilitation, and the list goes on, all of which is on the chat for you. Please do give us a call at 877-827-2666 or email projectconnect@adaptcommunitynetwork.org to get started on applying for these services, or if you're looking to refer people for these services. I also wanted to mention ADAPT Community Network received federal funding this year for a different home modification program. For those of you that are familiar with our program, we have the FSS grant, we have the Access to Home, which we've had for several years running. But now we also have a grant specifically for older adults living in New York City who are 62
I'm just
years,
listening, John. It's fine.
who are 62 years of age or older. This grant is not only applicable for people within our IDD community, but for the general public as well. So think parents, grandparents, your own parents or grandparents, yourself if you are 62 years of age or older and require a home modification. There is a financial component to the eligibility. I'll put some information about that in the chat along with our flyer. But if you know of anyone who is in need of a home modification, 62 plus, living in the city, please reach out. Again, the number is 877-827-2666 or Project Connect at ADAPT Community Network. Thank you.
Thanks, Wendy. Laura?
Good morning, everyone. My name is Laura Evans. I am with Include NYC. So we offer free services to families who have children with disabilities. So one service is our helpline, families who are navigating issues in special education or navigating raising a child with a disability are welcome to call our helpline and set up an appointment. They can speak to us for up to an hour. We also have our website where we post our free webinars. So those are webinars, and we also have in-person events as well as a parent support group. And then one event that I wanted to flag, which I saw somebody already flagged it, so thank you. We have our Include NYC Fair coming up on January 24th. That's going to be 10:30 to 3 p.m. at the Shed at Hudson Yards. So young people with disabilities and their families will have the opportunity to meet face-to-face with recreational programs, summer camps, health, and educational organizations. Families can register. I'll drop the link and the information in the chat. And if you are an organization who is interested in participating as an exhibitor, we are actually fully booked, I found out this morning, but we do have a wait list. So if you're interested in being added to the wait list, I'll have that information in the chat as well. Thanks, everyone.
Thanks, Laura. Lindsay?
Hi, everyone. Good morning. Sorry, my camera's not working this morning. But I am Lindsay Stilson, the Outreach and Marketing Specialist for Goodwill. We have some openings in our Day Hab Without Walls, Respite, Advanced, and Supported Employment Services located in East Harlem. All of those programs have a focus on gaining independence and employment. I am going to be hosting an open house at our Harlem Possibilities in January. And once the flyer is completed, I will share it with the council. And if you have any questions, you can give me a call or an email, and I will put all that information in the chat. Thank you.
Thank you, Lindsay. Any other announcements? I know we're virtual only this month, but I gotta tell you, I do miss the in-person and the going around the room as well. We will be back to hybrid next month. So if there are no other announcements, I don't believe Rihanna is here for any New York City Department of Health and Mental Hygiene updates. So we'll move on to OPWDD updates. And we have quite a showing in representation from OMRDD. So Contessa or Sam?
Good morning. This is Samari Tadessa. I'm actually joined by a couple of people today, which is nice. It's usually James or I, but you have the benefit of a couple of extra people. So we have Contessa Officer. I believe she attended the last DD Council, so she is one of our newest deputy directors. And Contessa, you can introduce yourself, and also, I'm sorry to introduce yourself, but you know what I mean, present. But we also have another person who's joined us, who's another deputy that we recently hired as well, and that's Jennifer Morrison Diallo. So with that being said, whichever one of you would like to speak next, I pass the baton.
This is Dave again. I'm going to go ahead and introduce or let her introduce herself. Our bridge director.
Hard to understand you.
Yeah, Contessa, you sound a little far away from the microphone.
Contessa. Is that better? No. Oh,
It has an echo almost.
Not really sure where that is coming from. Let's see. Can do. Hello. Still sounds like an echo.
But you still sound a little far away. They have a call-in option, I believe, if you would like. I think so.
Contessa, in the meantime, why maybe you figure out the audio? I can at least introduce myself and then you can do the next pieces.
So I'm Jennifer Morrison Diallo, and I'm the new Bridge Deputy Director for Region 3 and 4. So I'll be overseeing our quality management and technical assistance programs. So a lot of stuff, between anything data related, quality processes improvements across the 2 regions. So that's my new role. I've been here about 4 weeks now, about a month. So nice meeting everyone here and looking forward to working with all of you and partnering with you.
Welcome.
See if I'm getting any better. Am I getting any better?
Yes, much
bit.
better.
A little bit, yeah.
Much better? Okay.
Yes.
All right. I don't know what's going on, but okay. I do have a little bit to share. First, I want to talk about self-direction. So while self-direction offers great opportunity for individualized person-centered support, people who are self-directing have said that the program can be improved with better policies and practices, greater consistency in how things are done across the state, and a simpler budget process. The evaluation considers how OPWDD program compares to programs in other states and countries, and analyze service gaps, identify potential efficiencies, and outline areas of inconsistency. In April of 2023, as part of the race mediated to New York State via the American Rescue Plan Act, the New York State Office for People with Developmental Disabilities issued a self-direction assessment request for proposal for the purpose of procuring consulting services from a responsive and responsible vendor to study and evaluate the self-direction program, policies, and processes in order to deliver a more consistent and sustainable self-direction service model. So the goal of the evaluation included the following: learn how self-direction can better support people, especially when they do not have family or friends to help. Share how to provide clear and easy to understand information about self-direction. Better understand the needs of children who use self-direction. Improve and clarify the role of fiscal intermediaries, support brokers, and peers. Support, of course, all people who need OPW services to learn how to access self-directed service. Provide a way for people who use self-direction and providers who support them to work together and tell OPWDD what they want us to know. Make the self-direction model long lasting for people who use it and cost-effective to implement. And look at how self-direction rules can be changed to support growth of the self-direction model. All that being said, the report lays out 8 broad recommendations in 3 categories, resulting in 33 sub-recommendations. Our next steps include an internal review and decision-making on prioritization, resources, and goals, as well as consideration for constituent engagement. So we will bring more to you in the next meeting, but just wanted to outline that for you. As well, we are happy to report that the CAS and CANS information sessions that we had were successful in reaching a large number of people, self-advocates, families, providers, and CCO staff. And by the conclusion of our statewide information sessions, 2,295 people attended one of the various sessions offered, either virtual or in person. And I was able to attend one of the in-person ones. It was great. We truly appreciated the opportunity to meet with people and hear about their experiences, as well as hearing their feedback and suggestions for the future of our assessment process. So what did OPWDD learn or hear from people that was affirmed? What actions will we take, or are we taking because of the engagement and what was learned? So let's break this down. We learned that the presentation format, structure, and delivery were both appreciated and well received. The information we shared was heard, We received significant positive feedback about how we provided the information, etc., how it was organized and delivered. People appreciated the videos and how we explained things and answered their questions. While webinars can reach maximum numbers, we learned that in-person presentations and discussions were valuable to communicating and understanding complicated issues regarding the assessment. It was helpful to have engagement of our SPS staff and CCO staff at the presentation to demonstrate our commitment to CAS and CANS and to reinforce that assessment is a collaborative goal of us all. So what is OPWDD doing? OPWDD will continue to explore and use multiple modalities, including video, social media, in-person engagements to communicate both functional one-on-one information and to provide regular updates about the role of CAS and CANS to the people we serve. We will continue to seek collaboration with people, self-advocates, families, as well as CCOs and providers to inform our future communication. We will endeavor to set communication in a communication session in 2026. We did learn that people want more information and support and assurances that the assessments are being utilized and adding value for the people we serve. Some key areas are people deserve to better understand the explanation of 3-day look back and how that does not preclude capture less frequent, but important is still captured. People must always have a choice for either in-person or virtual assessment. People want to better understand who should be involved in the assessment interview and how that can happen in a person-centered way. People and our stakeholders want to know that CAS and CANS can to effectively support the people in their part of the system of care. So what is OPWD doing? OPWDD will be posting a recording of our person and family presentation to support communication around key areas. We are reviewing issues raised and questions received during the information sessions with the goal to identify other areas where we can develop communications that use plain language and are easily digestible by people and families. We will continue to work towards integration of the assessments into comprehensive care organization, provider rates and fees, and personal resource allocation. We are continuing to develop and enhance training for care managers to support people and families. And we are looking at the ability to create other information that can be used by care managers and families to make changes that may improve understanding of the assessment reports, making them easier. We heard that people have more general concerns about assessment, and they want OPWDD and other stakeholders to understand these concerns. For example, people are feeling that they may be over-assessed, but also want to participate in a meaningful way in their assessments while limiting stress on the person. We heard people share their challenges and concerns with care management, highlighting that it is important for the assessments and information learned through review to be utilized to improve care planning services and support. We learned that people may lack an understanding of the CAS or CANS concern process, and they also experience some frustration with the concerns process. All right, so what is OPWDD doing? OPWDD will continue with their collaboration with people and families, of course, our CCOs and provider partners, on areas of preparation for and scheduling of assessments and using assessment information more proactively in care planning, including the life plan cycle, reduce redundancies, work in underway to explore connection between assessment and CCO care planning tools. We are also looking at adding features to our post-assessment survey that will allow people to share their experiences outside of the concern process, so we can continue to learn more about their experiences. And we will be working with people and self-advocates about how we can, as a system, address sensitive issues that may come up in the assessment process in a more supportive way. I know that's a lot of information, but we did want to share with you that, we did take a deep dive into these assessments these sessions. We wanted to get a lot of information out of it, so they were very productive. We learned a lot, and we are going to be utilizing what we learned to make it clear. That is all I have.
Thanks, Contessa. Questions? Jackie?
Hi, good morning. I wanted to ask if there's any timeline for when you file for review. I personally, my CAS has been in review for 4 months. I'm wondering if OPWDD has any timeline that they are aiming for in terms of how long it should take if you need to have your CAS reviewed.
I will get back to you on that. I will have to get back to you on that.
Paola?
I have questions regarding self-directions and the guidehouse assessment. It seems to be that still self-direction is mainly being used by families, Caucasian families, and not so much other groups. So I want to know what is OPWDD doing to perhaps educate or outreach to families of color so they could utilize self-direction the same way other families, Caucasian families specifically. I think the report says that it's used about 70%, 90% Caucasian families. However, the vice chair parent of the Queens Developmental Disability said that he dig a little bit more and it was more 75 or 74. It's still very high. So I want to know what is OPWDD now that you are aware that this is a reality. What are you going to be doing to perhaps support other families, families of color, brown and Black families, and immigrant families to access this service? Thank you.
Yes, thank you. That is a great question, and that is part of the process that we're going through now. Is OPWD is taking the information that they learned, and they are working on how they're going to move forward. So that is a great question, and I will definitely bring that up to leadership if that was asked here. And I definitely agree with you that, that number definitely, is something that, is eye-opening. And we want to make sure that all of our families understand what is available to them. If they qualify for particular service, that they understand that service and that they have the support to be able to move forward with that service if they feel it is in the best interest of their family and the individual in their lives. So that's a great question.
Ellie?
Yeah. Hi. Sam, you all have heard this question before. First of all, thank you for recapping the report. Again, why can't we get this report in writing? It's the same report that you give to all 5 boroughs. And you give it without any answers to our questions. So again, would you please tell your supervisors and go up to Willow and just ask? And can you tell me now what's the percentage of people using self-direction, adults and children, as to the total? My daughter does not receive self-direction, but we seem to spend 90% of our discussions talking about self-direction. And I'd like to talk a little bit. I'd like to have the conversation a little better balanced. I'm not anti-self-direction. I just want to know who it affects and how many people it is, and is it mostly children buying in at the moment? I'd like answers. Sam? I'm pointing to you because you're the old lady in the room, for OPW.
I'll let Sam answer it as well. So, to your point, I definitely understand I want to make sure that we're clear. You're talking about getting and writing the report. Are you talking about the talking?
The one that you read to us every month, yes.
Okay, yes. It is not available.
We know that, but why? And we've never been told why. And it's the same report to all 5 boroughs. It's really, bordering on being insulting.
No, I understand.
Because we could listen to the recording of the meetings that have gone on before and hear the same information. And you're not, when we ask questions, there's no back and forth. This is not specific to you. This is a question, I'm not targeting people. I'm just saying it's incredibly frustrating. And I'm an old lady and I don't like being frustrated.
I understand and I respect that, Ellie. Obviously I'm new here, so I appreciate
No, that's why I didn't direct it to you.
But I'm glad you shared it because I need to hear it because this is my first time hearing it. So I'm going to ask that question because I've never had it addressed. So I will ask that question, Ellie.
Thank you.
And I hope that moving forward, the conversation will be back and forth, that we will be able to answer your questions and bring in different team members that can answer questions better than maybe I can at this point. But in terms of self-direction, I do not have that percentage. I do know self-direction is, it's been, I remember when I first, was with OPWDD, self-direction wasn't a big thing. Most people they weren't using it. And since I've come back, it is huge. A lot of people are using it. We can definitely get you the percentage, and Sam might even have that information. But it is just one of those, it's one of those areas that, a lot of people, are much more interested in. It has increased significantly over the years. There's a lot of conversation about it, but it should not take over everything because there are other services. And like you said, you do want to have a balance. So I appreciate that, respect that. And we want to make sure that, if you have other questions about other services, that's being addressed and there's room to talk about it.
Well, if you look at the report that you gave, that it feels very unbalanced. So that's all I'm saying.
I understand. And I think that's because we just had that,
yes, which was available for review. So okay, yeah. I'm done. I'm not, this is not about you. This is not about Sam. This is not about anybody in particular. It's just incredibly frustrating.
I understand. Sam, did you want to speak to that?
She knows.
Yeah, I mean, this is a running point that the DD Council brings up from time to time. And regarding your data question, Ellie, I know that OPWDD over the next coming years, we're moving towards more data-centered reporting. So, I wish I had an immediate answer for you, Ellie, but I feel like we are moving at least in a positive direction, in a productive direction, because I know data is something that we have all wanted for a long time, and we're hoping to start being able to compile the data in a way that is easily and better understood by the public. Okay, so
well, you guys are the only one who has the data, so yes. Okay, I'm done. Sorry.
But it's a good question. Thank you, Ellie.
Jackie?
I just wanted to piggyback on what Ellie is saying. I think what would be valuable is when we hear from OPWDD, if you can put in the chat where we can read these reports in our own time and have more of a conversation, a back and forth when we're in meetings like this, whether in person or virtually. And welcome, Contessa.
Thanks. Wendy?
I'm just wondering, so you spoke about the next steps for self-direction, just a review and improvements or whatever may come about. How long do you expect that process to take?
Yeah, I wish I could answer that. I can't answer that at this point. I do know that they want to be comprehensive in how they're moving forward. There's a lot of information that was gathered in that report. There's a lot of different areas that they need to look at. So again, I wish I could give you an answer. But if they definitely want to make sure that when we bring something to you, it is solid and that we can answer your questions and that we've looked at different areas thoroughly. So that's why we do want to update, when we come back, to these meetings. It's been a month, so we want to give you an update. So great question. I don't have that. But we
And I
will
just
update you.
Thank you. I just had a follow-up. So this third-party agency company that basically surveyed the program as it is now and made these recommendations, put this report together, was there any surveying of parents who have self-direction and providers feedback? Because the number one thing is surprisingly the lack of understanding on the side of parents about how the program works. And that is just a major one. And then the second thing is having, brokers and FIs ask providers where they should be putting things, and how things are working in the budget. Coming from a provider agency, I do have some knowledge of self-direction, but obviously I don't know all of it. And it's really shocking when a broker asks me, like, what part of the budget should they include certain information on, what the process is, what are the next steps. I'm like, I could have sworn you took a 3-week course on how to do this. And it's just not happening. And of course, if they're confused, the parents are going to be confused as well. So yeah, just overall, that is the biggest concern. People signing up for these services. And the last thing, because I'm pretty sure this is the report, is the lack of understanding for some parents that when they're getting services for their children, the cost of the service comes out of the budget. I can't tell you how many parents say to me, well, that's my kid's money. I was like, yes, ma'am, but you're trying to get a service for your child. That's what the money is for. So that disconnect is just for lack of a better, it's astonishing to me that there's a lack of understanding that the budget is meant to pay for these services. And so not understanding that when you're signing up for these services, that's where the funding comes from. So anyway, I hope, I would expect that that's in the report that's been provided, but yeah, never fails to surprise me when a parent just does not connect those two things. Because that seems like one of the most basic things about self-direction. Anyways, just a little rant there. Thank you for listening.
Yeah, thank you, Wendy, for bringing those points up. I think with the broker and the parents, a lot of that is going to come down to education, more education, making sure that the broker knows their role, knows what they're supposed to know so they can educate the family, and the family is being educated so that they understand, what the budget, each line item, what it is, how it can be used, all of that. So that's education. And in terms of the were the parents involved? Absolutely. That was essential that they were involved. So there were a variety of individuals that were involved, and definitely the parents were involved because they needed to get that insight.
I'm glad to hear that. Thank you.
One more, Mary Krasner.
I think that if OPWDD is interested in expanding self-direction into other populations than that, those currently using it, they have to understand or acknowledge that the time, effort, flexibility, and sometimes money that it requires of families is the primary obstacle. It is not something everyone can do, especially if you are stressed by other factors. And until that's really looked at, it can't move beyond the people serving now who have effort, who can make the effort, who have the time, flexibility, because sometimes it means the parent rushing in when someone doesn't show up. It can't go further unless that's really, really looked at as being being a big obstacle. End of my rant.
Yeah, absolutely. Self-direction requires collaboration between a lot of people, but it's a service that a family has to be able to take on as a responsibility. You know, it's a bigger responsibility, and I think it has to be families have to know upfront what responsibility they're taking on and who would help them. So obviously, yeah, it is a lot of response. It's a lot more responsibility.
Thank you all. Good discussions. Moving on to IAC update, Mary?
Hi, good morning, everyone. I hope we have good discussions, but quicker discussions than poor Contessa and Sam. So just to a few updates on the IAC end. I just wanted to mention that earlier this month, the DSP Standard Occupational Classification, of course, acronym SOC, bill was introduced. This is a bipartisan bill that has been reintroduced to the Senate, recognizing the role of direct support professionals. The bipartisan legislation urges the Office of Management and Budget to establish a standard occupational classification for direct support professionals. The hope is that this will assist in stabilizing the workforce by accessing needed data to better understand how we can build on people's interest coming into this field to support people with IDD in the various settings, certified and or self-directed. The government shutdown ended on November 12th. Woohoo! Everything has been extended through January 30th. I don't know what that will mean come January 29th. Hopefully we'll have a smoother resolution than we did back in October and November. It's important to, continue advocacy. Please, everyone, whether you're a family provider, person receiving services, everyone has an elected official. It's imperative to go into their office, send emails, make yourself known, your constituent, to continue to ask and educate really your elected officials on what the needs of our field are and what our advocacy asks are for the governor this year. So when they're hearing it, when they're in session, they're aware of what we're talking about, and it's hopefully through the education, we'll be able to solicit their support as well. Let's see. The Office for New Americans has resources for new Americans with disabilities and their families. Please contact them if you have any questions. They also have a resource, the Family Preparedness Guide, which providers and families can use. And when I'm done with our report, I'll put that link in the chat for everybody in case you need it. All right. The NIDA had its rally on November 18th up in the Capitol. I unfortunately was not able to go, but what I've heard from colleagues who were able to attend, I heard it was the best rally yet. There was a lot of support. There was a lot of people up in the Capitol building who were familiar with us and our asks. There also have been a number of NIDA roundtables where leadership from the providers as well as family members have met with regionally elected officials to talk about our collective asks under NIDA. And just a very quick recap on what we're advocating for this year is we're asking for a 2.7 TII, targeted inflationary increase. We don't use the term COLA anymore because that means different things in the law and funding and budgets. So we're asking for a targeted inflationary increase. We're asking for some infrastructure and care system investments related to prior property approval, capital funding, demonstration programs, an increase in residential reserve for replacement, which is known as the RRR. Hi, Margaret. That's to, to be able to tap into monies to do repairs or renovations for people who, so that they can age in place in their homes and their programs, and all that kind of stuff. And I'm sorry, and also including some Go Green initiatives, like solar paneling, for sites and offices, so that providers can be in compliance with the local mandates. And then lastly, we're asking for a number of CareForce affordability initiatives stemming from creating an affordable housing lottery for frontline workers, looking at capital funding for new childcare investments to support our frontline staff who work the atypical shifts, whether it's 3 to 11 or overnight shifts, so that they could access affordable childcare, so that they can ensure their loved one, their child is being well taken care of while they're working to take good care of the people being supported. We're looking to expand New York State child tax credits for DSPs and human service workers. So there's a little bit more in the weeds, but those are the general highlights. IAC is hosting their lobby days on February 10th and 11th of 2026. There'll be more information coming out on that. And again, just to reiterate, even if you can't, going up to Albany and lobbying is great. It's, exciting and you learn a lot, and we're all together fighting for the cause, but it doesn't replace going to your own local elected official and popping in as a constituent, letting them know these are the things that you want them to support. I won't go over the self-directed report from Guidehouse. Let's see. There was a provider association meeting yesterday. The commissioner, in her updates, similar to what Contessa and Sam had shared with us, so I won't go over that too much. Just for providers to know, hopefully sometime in January, Abiba and Delia Tucker will be rolling out a webinar to assist providers on better understanding letter of interest request versus a letter of intent response, I'm sorry. And also to assist with some of the technical details of looking for prior PPAs and funding for residential needs, whether it's new or existing programs. Megan O'Connor shared that down the road in 2026, there will be a revision to something related to Jonathan's Law. Currently the process is that when a guardian or loved one wants to obtain a request of the investigation, they have to submit in writing. There's a whole process under Jonathan's Law to the provider requesting a copy of the redacted report. OPWDD has worked with the Justice Center in an effort to streamline some of these processes for families so that they're looking to introduce an annual request that a family member can sign and an agency will keep on file that will allow them, will give them access to copies of reports for the entire year. They're still on, so it's not that right now it's families have to ask per incident for copies of the reports. This change will make it a one-time annual standing letter for any incidents that occur in that year. The commissioner also shared that she hopes that by the end of this year, by New Year's Eve, that there will be a release from OPWDD on an update to the annual strategic plan, summarizing the successes, where we are currently in the plan, and hopes for 2026. I also, during the Provider Association meeting, it was also brought up again that now the 679 regulations, which are related to the Article 16 clinics, will hit the state register on December 31st. And I'm going to say ish, because we know that sometimes that date changes, usually a few days further. Once it hits the register, then it will be released by OPWDD with a 60-day public comment period. Although the regulation is making changes that provide some administrative relief to the Article 16s related to the number of hours that a clinic director has to be on site, the number of times per year that a treatment plan is to be reviewed and revised by the medical director. The most concerning thing is that the regulation is now going to state that in order for someone to receive ongoing treatment at the Article 16s, they have to first be determined eligible for services at the Article 16 by OPWDD. And, we have a number of people across the state who, for whatever reason, whether it's functional capacity or, just personal choice, are not currently receiving services at an Article 16, i.e. physical therapy. However, they are not in the OPWDD system. So, but they go to the Article 16 because they have CP and they know that a physical therapist there will be able to provide them with appropriate treatment. Unfortunately, now for someone in that case, that individual is going to need to get eligibility, which requires the testing, the care coordination, connection, and all of that. So, again, this has been in process. I want to say probably going on close to 3 years now that the regulation was first supposed to come out. And they are telling us that this is definitely coming out and that the 60-day public comment probably will be sometime in January, February. And I think that's about it, unless anyone has any questions about anything I spoke to or anything I should have spoke to.
Thanks, Mary. Any questions?
Yes.
Margaret.
Hi.
Hi, Margaret.
Hi. Hi, Mary. Are you going to send us the asks separately? That would be very helpful.
I can. Kathy, can I send you the NIDA cheat sheet that you can distribute to everyone?
Absolutely.
Okay.
Yep.
Thank you.
We'll distribute it and also have it posted on the website.
Perfect. I'll get that to you today.
Thank you, Mary.
Oh,
Thank you,
my
Kathy.
That was an easy question, Margaret. Thank you.
I think there's a question in the chat that's just coming in.
Let's see. Let me get to it.
It's, can someone in the position Go ahead,
Hi,
Andrew.
that's me. Um,
Hi, Andrew.
thank you for sharing that information. Regarding the situation of someone who's receiving Article 16 services but's not OPWDD eligible and wants to keep receiving those services, so needs to get eligibility, are the clinics allowing any kind of like expedited appointments for evaluations that can be used for eligibility for someone in that situation?
Um, there's nothing official that has come out, but I can tell you through my discussions with our members who provide Article 16 services, they are committed to keeping the continuity of services to the best of their ability, and they certainly would fast track someone who is an existing patient to have the evaluations required for eligibility. Okay, so I don't know if
Thank you.
that answers, but if there is someone in that situation, they should start moving now to try to get that, or their family can take that upon them, the conversation with the clinic administration and get that going.
Thank you.
Thanks.
That sounds helpful.
Okay, you're welcome.
Thanks, Mary.
Okay. And
Then,
then I'll just say merry everything and happy always to everybody on the call. And I look forward to seeing you all next year.
thanks, Mary.
Okay. Bye-bye.
Bye. Before we move on to committee reports, I just want to let people know that the five borough DD councils will once again be hosting a virtual legislative event. And the date of that is March 6th. Time and details to follow, but just keep that on your calendar. Then we'll move on to committee reports. The Manhattan Family Support Service Advisory Council, Mary or Jackie?
You want me to go, Mayor? Okay. Good morning, everybody. Yes, we had a great meeting with Sarah Grimes from NYSARC, who presented about how to maximize benefits for our loved ones. Did a very detailed presentation about the ABLE account and about Special Needs Trust. We had over 30 people attending and got very positive feedback. Also, if anybody missed Kathy Kelly's amazing presentation that she did on benefits, those two together basically kind of cover all the concerns. So appreciate it on both ends. And Mary, did you want to add any? We are going to be rescheduling our dental presentation in January. It just became too complicated with the holiday and conflicts, but we will do that, and we will be sending information out soon. And I don't see Mary, so I don't know if she wants to do any statewide. I think that's it for us. Thanks.
Thanks, Jackie. Transition Committee, Andrew or Pat?
Hi, everyone. A report for Manhattan Transition Committee. Our committee focuses on transition from school age into adult life, with a focus on supports and services for Manhattan residents with IDD. Last week, we had a great presentation by Lily Lopez at the New York Connects program at Sydney. Continuing the theme with benefits, she presented a lot of good information about how their program can help you connect with benefits, supports, and services, and even figure out what supports you may be eligible for but not accessing already. Our next meeting will be in February. It's Wednesday, February 11th at 10 a.m. And this is a special one. This is our annual Manhattan Adult Services Showcase. That's going to be online. It's on Zoom. And it's a series of presentations by agencies that provide services for young adults with IDD. We're going to feature information about rehabilitation programs, employment services, OPWDD, and other supports for the future. And we have 17 different agencies presenting. So it's if you are supporting a young person with a disability getting ready to transition out of high school, or you're a young person with a disability yourself, this can be a really good one-stop shop to learn a little bit about what's out there. Again, that will be February 11th, 10 a.m. on Zoom, and expect some information coming out after the new year. If you're not already part of our email list, there's a link in the chat where you can sign up. And you can also check for that info on our website, manhattanddcouncil.org, and hope to see you there.
Thanks, Andrew. The Family and Provider Information Committee, Wendy or Manwati.
Hi, everyone. Hello again. So as well as being part of ADAPT, I am the co-chair of the Manhattan Family and Provider Information Committee. Tomorrow will be our first meeting for this calendar year, because unfortunately we had to reschedule due to scheduling conflicts. We will be focusing on underutilized family support services programs in Manhattan. There's several of them. And in the spirit of the saying that if you don't use it, you'll lose it. We definitely want to bring attention to those underutilized programs. There's a few agencies that offer these services, and they're really helpful. We want to bring information to you about what they are, how they may be of assistance to you, and what agencies are currently offering these services. So this meeting is for both care managers and families, actually for everyone and anyone who would like to attend. I put the information in the chat. I'll paste the link in again, but it's also on the Manhattan DD Council website, which is manhattanddcouncil.org, in case you have not visited this year, this calendar year, this school calendar year, because that's the calendar that we follow. Please do so. There's a lot of great information there, including our Family Support Services Directory, which takes about a couple of months for us to review and update in all three languages, the Spanish, English, and Mandarin that we have now. So please be sure to look at those resources, share those resources. Many of those services are there for you. And we really want to make sure that the parents are and people supported are connecting with these services. I mean, they're there for a reason. So yes, please join me tomorrow, or join us. Manwati, I'm sorry, I was leaving you out. Please join us tomorrow to learn what these services are, how they may be useful to you or the families that you support, and what agencies you can reach out to in order to receive these services. So I look forward to seeing hopefully all of you, plus your friends, there tomorrow. Thank you.
Thanks, Wendy. Any other final notes before we end this meeting? Then just a quick note, next meeting, actually we will likely have a change in date for our January meeting. It will be on January 27th, so it'll be 1 week later. And it will be hybrid with the in-person location here at AHRC at 83 Maiden Lane. So we'll have that info coming out, reminders coming out, as well as being posted on the website. Then on that note, Mayor, go ahead.
Pat, why are we switching that?
Because I can't make it on the 20th.
Oh, okay.
Is there a problem?
I literally just wrote it in January because it's always the 3rd. So
I know.
I didn't know if we had a rally or something in Albany.
No.
Okay. Thanks.
Then on that note, I wish you all very happy and safe holiday season. And we will see you all, if not tomorrow, then in 2026. Thank you and have a great day.